Some breaking news now. In the last few hours, we have learned that the West Nile virus has been detected here in the Triangle. The CDC reports finding the virus in a blood donation in Durham County. Beyond that, we know at least 6 people in our state have gotten sick from West Nile, and that's just one of the mosquito-borne illnesses spreading right now. WRAL health reporter Grace Haba visited a lab at UNC, working to figure out what makes some people sicker than others after a bite.
It usually starts with a scratch. And for most, that's where symptoms stop. But for others, a mosquito-borne illness can be more serious.
One thing that my lab's really interested in understanding is why is it that only some people get sick?
Helen Lazier and others at UNC have been researching mosquito-borne illnesses, including West Nile virus, for years. She says the biggest problems occur when the virus spreads to the central nervous system.
When that happens, that's very serious. So if people develop encephalitis or meningitis, they have to go to the hospital.
So far this year, Buncombe, Rutherford, and Cleveland counties have all had people test positive for West Nile virus. Now, state health officials tell me that number is expected to rise here in the coming weeks, with 3 more people now hospitalized in Columbus County. We also now know that Durham County recently detected the virus in a blood donation, and it's believed that that donor here in the Triangle did not have any symptoms.
The majority of people who get infected with West Nile virus, around 80%, actually will not have any symptoms whatsoever.
About 20% will have mild symptoms like fever and a rash. But for a rare 1%, hospitalization, even death, could occur after a mosquito bite. Most infections occur in summer months. State data shows older adults are at the highest risk, but exactly why remains unclear.
Some of that might have to do with how the immune response changes as people age, but that's something that people are actively studying to learn more about.
Grace Haba, WRAL News.
Health officials say using bug spray with DEET, wearing long sleeve clothing when they're hiking, and just getting rid of standing water in your yard. Those are all ways to reduce your risk of getting bitten.